Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function after 60. I am your host, and today we're covering a silent epidemic that's quietly destroying the skeletons of millions of men, accelerated bone calcium loss that's happening right now while you're completely unaware. Osteoporosis isn't just a women's disease. Research shows that 1 in 4 men over 50 will suffer an osteoporosis-related fracture in their lifetime, and hip fractures in men are twice as deadly as in women. The tragedy is that your body is sending you warning signals right now, subtle signs you're probably dismissing as normal aging. These early warnings are your window to intervene before you suffer a devastating fracture that could end your independence or even your life. Before we dive into the 9 early warning signs, let me share Raymond's story. At 66, this real estate agent from Miami considered himself reasonably healthy. Then one afternoon, he sneezed while reaching for a file cabinet and felt a sudden sharp pain in his mid-back. "I thought I'd pulled a muscle," Raymond told me, "but the pain didn't go away. After 3 days, I went to urgent care, and they took x-rays. The doctor told me I'd fractured a vertebra from sneezing. I couldn't believe it. Further testing revealed severe osteoporosis. Raymond's bone density T-score was negative 3.2, meaning his bones were significantly weaker than they should be. The doctor asked if I'd noticed any warning signs, and as we talked, I realized I had been experiencing several symptoms for years that I'd completely ignored. Raymond's fracture was preventable. His body had been sending him warning signals for years, but like most men, he dismissed these signs as normal aging. Today, I'm going to reveal the 9 early signs of accelerated bone calcium loss that you're probably ignoring every single day. Early warning sign number 1, receding gums and loose teeth. The first early warning sign that most men completely overlook is changes in their gums and teeth. Receding gums, where your gums pull away from your teeth, loose teeth, or teeth that shift position, and tooth loss that isn't directly caused by cavities or gum disease. Your jawbone is bone tissue just like your spine and hips, and it's subject to the same calcium loss. When your body is losing calcium faster than normal, your jawbone is often affected first. Research published in the Journal of Periodontology has documented strong correlations between systemic bone loss and jawbone loss, with studies showing that men with osteoporosis have significantly higher rates of tooth loss and periodontal disease. As your body loses calcium from your bones systemically, your jawbone becomes less dense and less able to support your teeth. The socket that holds each tooth weakens, allowing gums to recede and teeth to loosen. This happens years before bone loss in your spine or hips becomes symptomatic. Raymond had noticed his gums receding over 3 years. His dentist mentioned it, but attributed it to aging. He'd also lost 1 molar due to bone loss around the tooth, but neither he nor his dentist connected this to systemic bone loss. If you're experiencing receding gums, loose teeth, or unexplained tooth loss, this is a red flag that your entire skeleton may be losing calcium faster than normal. Early warning sign number 2, weakening grip strength. The second early warning sign is declining grip strength that you've adapted to without recognizing. Grip strength is strongly correlated with overall bone density and is one of the best predictive markers of bone health. Research published in the Journal of Bone and Mineral Research has documented that men with weaker grip strength have significantly lower bone mineral density and higher fracture risk. The correlation is so strong that grip strength testing is being considered as a screening tool for osteoporosis. Why does grip strength correlate with bone density? First, strong muscles create mechanical loading on bones that stimulates bone formation and calcium retention. When grip strength declines, it reflects both muscle loss and bone loss occurring simultaneously. Second, the factors causing accelerated bone loss. Vitamin D deficiency, low testosterone, inadequate protein also cause muscle loss. You might notice difficulty opening jars that you used to open easily, needing 2 hands to carry grocery bags you used to carry with one, and dropping things more frequently. Raymond had noticed he struggled to open jars and bottles. He'd started using rubber grips and asking his wife to open stubborn lids. If you've noticed declining grip strength, this is a warning sign that demands attention. Early warning sign number 3. Height loss, more than half an inch. The third early warning sign is height loss, specifically losing more than half an inch compared to your peak adult height. While some height loss is common, significant height loss indicates compression of vertebrae due to bone loss. Research published in the Journal of Clinical Endocrinology and Metabolism has documented that height loss exceeding 1.5 centimeters is associated with significantly increased risk of vertebral fractures, with each centimeter of height loss increasing fracture risk by approximately 20%. When bone density decreases, vertebrae can develop small compression fractures or gradually compress under body weight. These often occur without obvious trauma or pain, called silent fractures. Over time, multiple compressed vertebrae result in measurable height loss. By the time you've lost noticeable height, significant bone loss has already occurred. Raymond realized he'd lost nearly 2 inches compared to his height at age 30. This substantial height loss indicated multiple vertebral compression fractures, which imaging confirmed. If you've lost more than half an inch of height, you need immediate bone density testing. Early warning sign number 4. Chronic lower back pain. The fourth early warning sign is chronic or recurrent back pain, particularly in the lower back or upper back between the shoulder blades, that isn't clearly related to injury. Research in Osteoporosis International has documented that many men with osteoporotic vertebral fractures experience chronic back pain for months or years before a clinically apparent fracture occurs. Weakened vertebrae develop microfractures, tiny cracks that don't cause complete collapse but do cause inflammation and pain. These microfractures eventually lead to compression fractures. Key distinguishing features of back pain related to bone loss include pain that's worse with standing or sitting and improves with lying down, pain located primarily along the spine, pain that developed gradually without clear injury, and pain that's persistent over months despite treatment. Raymond had experienced lower back pain on and off for about 3 years. He'd seen a chiropractor and tried physical therapy with temporary relief. No one had considered that his persistent back pain might indicate weakened vertebrae. If you have chronic back pain that fits this pattern, insist on imaging and bone density testing. Early warning sign number 5. Brittle, weak fingernails. The fifth early warning sign is changes in your fingernails. Nails that are brittle, break easily, split or peel in layers, are unusually soft or bend easily, and have ridges. Research in the Journal of Cosmetic Dermatology has found correlations between poor nail health and low bone mineral density. The same deficiencies causing accelerated bone loss, particularly calcium, vitamin D, magnesium, and protein, also impair nail health. Brittle nails can be an external, easily visible sign of internal mineral depletion. Raymond had noticed that his fingernails had become much weaker over the past few years. They broke easily, split in layers, and seemed softer. He'd assumed it was just aging. If your nails have become noticeably weaker or more brittle when they weren't before, consider this a potential warning sign of mineral depletion, especially if you have other signs on this list. Early warning sign. Number 6. Muscle cramps and weakness. The sixth early warning sign is increased frequency of muscle cramps, particularly nighttime leg cramps and generalized muscle weakness. Calcium and magnesium deficiency are common causes of cramps, and these same deficiencies drive accelerated bone loss. Calcium plays a critical role in muscle contraction and relaxation, and when inadequate, muscles become hyperexcitable, causing cramps. When your dietary calcium is inadequate, your body maintains blood calcium by pulling from bones. Research in Osteoporosis International has documented that men with osteoporosis have significantly higher rates of muscle cramps and weakness. Additionally, vitamin D deficiency directly causes muscle weakness and increases cramping. Vitamin D receptors are present in muscle tissue, and vitamin D is necessary for normal muscle function. Raymond had been experiencing increasingly frequent leg cramps at night over the past year or two. They'd wake him from sleep with severe calf pain. He also noticed his legs felt weaker when climbing stairs. If you're experiencing frequent muscle cramps or muscle weakness, these could be signs of the same deficiencies causing bone loss. Early warning sign number 7, fractures from minor trauma. The 7th early warning sign is experiencing fractures from minor trauma that wouldn't normally break a bone. This is called a fragility fracture, and it's one of the most significant warning signs of osteoporosis. A fragility fracture is defined as a fracture from a fall from standing height or less, or from minimal trauma. Research published in the Journal of Bone and Mineral Research has documented that men who experience even a single fragility fracture have dramatically increased risk of subsequent fractures. A fragility fracture indicates that bone loss has already reached a critical level requiring immediate intervention. Common sites include wrist fractures from catching yourself during a fall, vertebral compression fractures from bending or sneezing, rib fractures from minor impacts, and hip fractures from falls. Raymond's vertebral fracture from sneezing was a classic fragility fracture. Before that, he'd broken a rib bumping into a door frame. If you've experienced any fracture from minor trauma, this is a medical emergency requiring immediate bone density testing and treatment. Early warning sign number 8, chronic fatigue and low energy. The 8th early warning sign is persistent fatigue and low energy that can't be explained by obvious causes. Calcium and vitamin D deficiency, the same deficiencies driving bone loss, are often overlooked causes of chronic fatigue. Calcium is essential for cellular energy production, and vitamin D is essential for mitochondrial function. Research in the Journal of Clinical Endocrinology and Metabolism has documented that vitamin D deficiency is strongly associated with fatigue, and that supplementation improves energy in deficient individuals. Raymond had been feeling more tired than usual for several years. He'd attributed it to aging and stress. After correcting his vitamin D deficiency and calcium intake, his energy improved substantially. If you're experiencing persistent low energy, get comprehensive testing including vitamin D, calcium, and testosterone. The same deficiencies causing fatigue may be silently destroying your bones. Early warning sign. Number 9, family history of osteoporosis. The 9th early warning sign isn't a symptom but a risk factor. Family history of osteoporosis or fractures in parents or siblings. Research published in Osteoporosis International has documented that men whose mothers had osteoporotic fractures have 2 to 3 times higher risk themselves. Bone density is significantly influenced by genetics, with 60 to 80% of peak bone mass genetically determined. If your parents or siblings experienced fractures from minimal trauma or were diagnosed with osteoporosis, you are at significantly elevated risk. Raymond's mother had suffered a hip fracture at age 72. Raymond knew this, but had never considered that osteoporosis could affect him as a man. If you have family history, don't wait for symptoms. Get baseline bone density testing at age 50 and implement aggressive prevention. Raymond's recovery protocol. Let me tell you exactly what protocol I designed for Raymond. First, aggressive vitamin D supplementation. His level was 22 nanograms per milliliter, severely deficient. We started 10,000 IU of vitamin D, 3 daily for 12 weeks, then 5,000 IIU maintenance. Second, calcium supplementation, providing 1,200 milligrams daily in divided doses with meals. We added vitamin K2 at 200 micrograms daily to direct calcium into bones. Third, adequate protein. We increased from 60 grams to 100 grams daily. Fourth, resistance training 3 times weekly, including squats, lunges, deadlifts, and rows with progressive resistance. Research shows resistance training can increase bone density by 1 to 3% per year. Fifth, we addressed his low testosterone at 285 nanograms per deciliter with replacement therapy. Sixth, we prescribed bisphosphonate medication to rapidly reduce bone loss. After 6 months, Raymond's bone density scan showed stabilization. His bone loss had stopped. After 12 months, his bone density had increased by 2.5% in his spine. After 2 years, he'd experienced no further fractures, his energy dramatically improved, his back pain resolved, and he regained confidence. I went from feeling like a fragile old man to feeling strong again, Raymond said. Your action plan. If you've recognized even 2 or 3 of these 9 warning signs, here's your action plan. First, get bone density testing immediately. A DEXA scan measures bone mineral density and provides a T-score. Below -2.5 indicates osteoporosis. Second, get comprehensive blood testing, including vitamin D, calcium, magnesium, testosterone, and thyroid function. Third, ensure adequate calcium intake of 1,200 milligrams daily. Fourth, optimize vitamin D with 2,000 to 5,000 international units daily, aiming for blood levels of 50 to 80 nanograms per milliliter. Take vitamin K, too, at 200 micrograms alongside. Fifth, consume adequate protein of at least 1 to 1.2 grams per kilogram body weight daily. Sixth, implement resistance training at least 3 times weekly. Seventh, if testosterone is low, discuss replacement with your physician. Eighth, eliminate risk factors, including smoking and excessive alcohol. The 9 early warning signs: receding gums, weakening grip, height loss, chronic back pain, brittle nails, muscle cramps, fractures from minor trauma, chronic fatigue, and family history. Are your body's alarm system telling you that your skeleton is in danger? Most men dismiss these signs as normal aging until a devastating fracture occurs. Raymond's story demonstrates both the danger of ignoring these signs and the possibility of recovery when they're recognized and addressed. Your bones are living tissue capable of remarkable regeneration when given the nutrients, hormones, and mechanical stimulation they need. Don't wait for a fracture to take action. Pay attention to these warning signs, get tested, and implement the protocol to maintain strong, healthy bones for decades to come. Thank you for watching Men's Health 365. If you found this helpful, please like, subscribe, and share.